Hello and welcome to our podcast series. My name is Megan Drella and I'm a Senior Solutions Manager here at Outsource Strategies International. Today we'll be discussing ICD-10 codes to report low vision and blindness. Ophthalmology and optometry practices must report the diagnosis for low vision and blindness on their medical claims using H54 ICD-10 codes. Low vision refers to chronic and visual impairments that cannot be corrected with glasses, contact lenses, or medical or surgical treatment. Low vision includes different degrees of sight loss, from blind spots, poor night vision, and problems with glare to an almost complete loss of sight. Blindness and low vision are not the same, as limited sight remains in the latter condition. As you know, February is Low Vision Awareness Month and it is also National Age-Related Macular Degeneration Month. AMD is the leading cause of low vision and blindness. Other causes include glaucoma, cataract, and diabetes. This month is meant to spread awareness about vision rehabilitation that can help people with low vision learn how to stay independent and make the most of their sight. Getting a yearly exam increases the chances of early detection and diagnosis of conditions that may lead to vision loss. Low vision can make it harder to do things like reading, shopping, or cooking. Ophthalmologists and optometrists concerned with the eye and vision measure visual impairments by making patients read letters on a vision chart, which is called as visual acuity. Two categories of low vision are partially sighted and legally blind. Partially sighted refers to visual acuity between 20/70 and 2200, with conventional prescription lenses, and legally blind refers to visual activity no better than 2200 with conventional correction and or a restricted field of vision less than 20 degrees wide. Visual aids are helpful for people with low vision. Popular low vision aids include telescopic glasses, lenses that filter light, magnifying glasses, hand magnifiers, closed-circuit television, and reading prisms. To document low vision and blindness in medical claims, the categories are mild or no visual impairment, moderate, severe, and blindness. ICD-10 Monitor provides a clear idea of those categories. Please refer to the article attached for this chart, as well as a list of ICD-10 codes associated with these procedures. It is important for the coding and billing staff to be very cautious in choosing specific codes, and they must be up to date with the payer policies to avoid claim rejections. I hope this helps, but always remember that documentation, as well as a thorough knowledge of payer regulations and guidelines, is critical to ensure accurate reimbursement for the procedures performed. Thank you for joining me, and stay tuned for my next podcast.